Hi, today I'm going to talk about the in-flight emergency procedure assignment, and my topic is heart attack. My course code is FSO310, and my name is Tehmina Malik. So, what is the heart attack? A heart attack occurs when the blood flow that brings oxygen to the heart is reduced or cut off. If blood flow is reduced or stopped for too long, the heart muscles begins to die. What are the signs and symptoms? Pain that may force the person to sit down or seek support, pain that may radiate to shoulder, arm, back, neck, or jaw, fear and anxiety, pale later blue, nausea and sometimes vomiting, profuse sweating, dizziness, shortness of breath, shock, low back pain most common in women. Daniel? So we have to describe what's the first aid protocol and procedure that we will follow in such medical situations. So, in flight first aid treatment for heart attacks. So, first of all, we have to obtain a medical assistance. Do not move the casualty unnecessarily. Place casualty in comfortable position. Semi recoiling uh, is usually best position. Loosen tight clothing at the neck, chest, and waist. Reassure the person to lessen the fear and anxiety. Help the conscious casualty retrieve their prescribed medication. Have casualty identify the medication by showing them to the container. If nitroglycerin, ask person if they use Viagra. If the person has taken the Viagra, do not assist them in the taking the nitroglycerin as it will decrease the blood pressure. Place medication in the hands of the casualty in order to assist them in taking it. Administer oxygen. Treat for shock. So describe and explain how we will react and address the medical emergency. So for that one, we have the emergency scene management. So first of all, we have to do the scene survey. Like we have to take a charge and call for help. Access hazard, make area safe, and investigate it what happened. Identify yourself, obtain consent. Access responsiveness, very important. We have also a primary survey, which is the ABC, which means airway, breathing, and circulation. But in the case of heart attack, we will use the secondary survey. The secondary survey is the step-by-step gathering of information to determine a casualty condition. The secondary survey is only completed if there is a more than a one injury or if a medical have delayed more than 20 minutes. So there are a four step to the secondary survey. Obtain history of the person by listing their signs and symptoms, determining whether they have any allergies or are on any medications, documenting known medical history, contents of last meal, and the events leading up to the injury illness. Check for medical alert devices. Obtain vital signs, conduct a head to toe examination, administer first aid for injuries and illness that are not life threatening. What are the medical sources and equipment available to us on board the aircraft? So yes, there are certain equipment available on board to treat the casualties in emergency medical situation. The first one is the first aid kit. All aircraft are equipped with the first aid kit, which can be used during the in-flight medical situation, and it contains all basic equipment that we can use for the medical emergency. We can also use the portable oxygen bottle (POT) are carried for flight attendant use when performing duties involving a decompression or for first aid to use treat ill or injured passenger to provide oxygen. We also have the medical kit, and medical it can be only used by the professional doctor and the physician and the professional nurse. Um, it is very important to communicate with the in charge and with the pilot to update the casualty condition. So, in case if we have to do the emergency landing or if the person is not responsive. So for that one, we have a third party, a Metlink that they will contact to them. That's all for now. Thank you.